Hi there, we're going to be doing some projections today to demonstrate Crohn's disease. This is my patient. She's been having some gastrointestinal problems such as abdominal cramps and diarrhea. We're going to take two different projections. The first one's going to be the AP upright abdomen projection, and the second one's going to be the PA prone projection of the abdomen. What we're going to do first is we're going to have a 40-inch SID on our tube, and we're going to put the image receptor in here. It's a 14 by 17 lengthwise with the ID blocker down. We're also going to go ahead and put our right marker on the image receptor because this is going to be her right side because her back is going to be up against the board. Before we have our patient do anything, we're going to have her change into a gown and remove all clothing items and jewelry so that no artifacts show up in our images, as well as ask them if they are pregnant because this is shooting directly through the stomach area. So we need to center at the height of the iliac crest. We want to make sure that mid-sagittal plane is also right down the center of the image. This gets them nice and centered. What we're going to do then is put a shield right in front of them to help protect some of the femurs because that's where your blood is made. And we're going to take our calipers and measure our patient so that we can find our exposure factors. She measures 21. When you look at your exposure factors, you want to make sure on your table or on your board that you have the upright, the wall bucky selected. And when you look at your exposure factors, you want to make sure that all three chambers of the AEC are selected. And in her category, we have KVP of 80 and a backup mass of 36. Before we take this exposure, we're going to close the door, but our breathing instructions are we're going to have her taking a deep breath and then blow that breath out, and we're going to close the door and take our exposure on that suspended respiration. Alright, now that we're done with the AP abdomen for upright, we're going to have the prone position. I'm going to have her lay down on her stomach on my table. And I'm going to raise the table up to get it into its detent, because then I can use the chart on the back of the tube to get up to 40 inches for the bucky, not the tabletop. Just making sure that that was in the correct detent. We're going to, again, use a 14 by 17 lengthwise. I went ahead and put my marker down by the ID blocker. We're going to put it in so that it's lengthwise. ID blocker down. And it's her left side because she's laying down this time on her stomach instead of on her back. We want to make sure that this is in transverse detent. And again, we're just feeling for the top of the iliac crest. For your central ray. And again, we're going to have her down just the mid-sagittal plane. You can feel for her spine for this. You're going to go up to the top of her and make sure that she's straight. She looks pretty good. All right. Then we're going to take our shield and put it again over her femurs to help protect her. Get her up as close as we can to the light. Again, you just want to make sure that all your stuff is lined up. And again, to get your exposure factors, you're going to take your calipers and measure. Shouldn't be much of a difference. Okay. I'm going to say 19. Alright, now when you go to do your exposure factors for the table, you want to make sure that your table bucky is selected for the abdomen. Again, all 3 chambers are going to be used. We're going to use, again, 80 kVp at 36 backup mass for the exposure factors because she's in that range again. And what we're going to do, again, when we go out to make our exposure, we're going to have her take a breath in and then blow all that breath out. We're going to close the door and make that exposure on the suspended respiration. We also want to make sure that we have our large focal spot selected for both of these projections because they are in the abdomen and not a bone exam.